61. Which of the following patients would benefit most from the application of the PSG/MAST? A. 10-year-old male, suspected spinal fracture, no blood loss. B. 72-year-old female, suspected cardiogenic shock, no blood loss. C. 40-year-old male, suspected lower extremity fracture, low blood pressure. D. 67-year-old female, suspected ankle sprain, high blood pressure. Answer: C. Indications for use of the PSG are to control bleeding, stabilize fractures, and raise blood pressure. Although its use is currently controversial, of the choices listed, choice C has the indications called for if PSG is to be used. 62. Care for the patient with cardiac contusion is similar to care for the patient with which of the following conditions? A. Closed abdominal trauma. B. Pericardial tamponade. C. Tension pneumothorax. D. Myocardial infarction. Answer: D. Patients with cardiac contusion can present with the symptoms of myocardial infarction, including life-threatening dysrhythmias. Care is similar to care of any cardiac patient. 63. Which statement about use of Nitronox in the field is correct? A. Nitronox is a short-acting agent that is administered via inhalation. B. Nitronox is used to manage pain in patients with COPD and asthma. C. Nitronox may be given to patients with acute abdominal distension. D. Nitronox may be safely used for patients with head injury. Answer: A. Nitronox is a short-acting agent that the patient self-administers by mask. Its use is limited to patients who do not have the potential for having air-filled spaces within their tissues, thus eliminating patients with COPD, pneumothoraces, or air-filled abdominal organs. 64. The most common cause of upper airway obstruction is A. Anaphylaxis. B. Croup. C. Epiglottitis. D. Relaxation of the tongue. Answer: D. The loss of lingual control during unconsciousness occurs more commonly than the other conditions. 65. Which of the following statements regarding treatment for the care of a patient who is suffering from complications of dialysis is correct? A. If possible, obtain a blood pressure reading on the arm on which the shunt is located. B. Watch for narrow complex tachycardia to develop as the patient becomes hypoxic. C. Monitoring for dysrhythmias is frequently unnecessary in a hemodialysis patient. D. To prevent exacerbation of the problem, start in-4 only if ordered by medical control. Answer: D. Fluid administration in dialysis patients should be under the direct authority of medical control. Dysrhythmias are common and, if present, are generally caused by electrolyte imbalances. To prevent accidental damage to the shunt, a BP should never be assessed on the arm with a shunt. 66. Knee, femur, and hip dislocation and fracture caused by the knees hitting the firewall and absorbing initial impact are common in frontal collisions with A. Down and under pathway. B. Down and back pathway. C. Up and over pathway. D. Up and back pathway. Answer: A. Up and over refers to injuries sustained in the head, neck, and chest region. In the down and under pathway, the body slides forward and downward. This can be limited by the correct use of seat belts. 67. A single-lead ECG tracing is useful for obtaining information about the heart. Which of the following can be determined from a single-lead ECG tracing? A. Mechanical response of ventricles. B. Cardiac output and stroke volume. C. Timing of electrical impulse travel. D. The presence of a myocardial infarct. Answer: C. A single-lead ECG used for routine monitoring can be used to determine the heart rate, regularity, and the length of time it takes for the impulse to travel through the heart. It tells you nothing about the mechanical response of the heart, of which stroke volume is a part. You need additional lead views to verify the presence of an MI. 68. What does the actual drawing of the QRS complex on an ECG tracing show? A. Only ventricular repolarization. B. Ventricular depolarization and atrial repolarization. C. Ventricular repolarization and atrial depolarization. D. Impulse travel through the atrioventricular junction. Answer: B. The QRS complex reflects the underlying ventricular depolarization, and buried within it is the atrial repolarization. 69. A QRS complex is considered abnormal if it lasts longer than how many seconds? A. 0.04 seconds. B. 0.08 seconds. C. 0.10 seconds. D. 0.12 seconds. Answer. D. The QRS complex normally lasts 0.04 to 0.12 seconds. Anything longer than 0.12 seconds is considered to be abnormal. 70. What is the treatment for a patient whose ECG shows premature atrial contractions include? A. Observation only as long as the patient remains asymptomatic. B. Vagal maneuvers and 6 mg adenosine rapid for pushover 1 to 3 seconds. C. 1 to 1.5 mg/kg lidocaine via slow for push, and consider sedation. D. Immediate synchronized cardioversion with 50 to 100 joules. Answer. A. If the patient is asymptomatic, this arrhythmia requires observation only. Other treatments described are for patients with varying degrees of supraventricular tachycardia. 71. Traumatic aortic rupture usually occurs as a result of transection of the aorta at the A. Pulmonary artery. B. Ligamentum teres. C. Ligamentum nuchae. D. Ligamentum arteriosum. Answer. D. Ligamentum arteriosum is the most common area for an aortic rupture secondary to trauma. 72. What is the clinical significance of a first-degree AV block? A. It signals the onset of rapid cardiovascular decompensation. B. It indicates that the heart rate may drop if action is not taken. C. It can lead to syncope and angina if not corrected quickly. D. It may foreshadow development of a more advanced dysrhythmia. Answer. D. First-degree AV block in itself calls for observation only. However, it may indicate the development of a more advanced heart block. 73. Wolff-Parkinson-White, WPW, syndrome is characterized by which of the following waveform abnormalities? A. QRS complex shorter than 0.12 seconds. B. Short PR interval and long QRS complex. C. Lengthened and bizarre QRS complex. D. Inverted P waves and normal QRS complex. Answer. B. Wolff-Parkinson-White, a pre-excitation syndrome, is characterized by a short PR interval and lengthened QRS complex. Often, a delta wave is present as well. This condition occurs in 3 of 1,000 individuals. 74. In which situation would you consider having the patient perform a Valsalva maneuver to slow the heart rate? A. Male, age 34, paroxysmal junctional tachycardia. B. Male, age 68, idioventricular escape rhythm. C. Female, age 74, premature ventricular contractions. D. Female, age 39, ventricular tachycardia. Answer. A. When PJT is caused by stress or excessive caffeine intake in a patient with no history of heart disease, the Valsalva maneuver can be successful at slowing the heart rate. 75. Which rhythm is likely to foreshadow the development of other, more serious dysrhythmias? A. Atrial fibrillation. B. Isolated premature atrial contractions. C. Accelerated junctional rhythm. D. Sinus dysrhythmia. Answer. C. Because the underlying cause is usually ischemia, accelerated junctional rhythm can deteriorate into more serious dysrhythmias. 76. What does a prolonged sinus tachycardia accompanying an acute myocardial infarction suggest? A. Cardiogenic shock may develop. B. Damage to the heart is minimal. C. Hypervolemia is the underlying cause. D. The diagnosis of MI is incorrect. Answer. A. In a patient with acute MI, sinus tachycardia suggests that cardiogenic shock may develop. 77. How should you position the patient to check for jugular vein distension? A. Lying flat on his or her back. B. Sitting upright near 90 degrees. C. Standing up in anatomical position. D. Seated at a 45 degrees angle. Answer. D. Check for jugular vein distension with the patient elevated at a 45 degrees angle. Most patients will have observable jugular veins when supine. 78. What does a carotid artery bruit indicate? A. Good peripheral perfusion. B. Obstruction of blood flow. C. Jugular vein distension. D. Congestive heart failure. Answer. B. A bruit, noisy blood flow in a vessel, indicates partial obstruction due to plaque buildup or the presence of an embolus. 80. The pain of stable angina is brought on by A. Exercise or stress. B. Imminent AMI. C. Difficulty breathing. D. Overuse of nitroglycerin. Answer. A. Attacks of stable angina are brought on by exercise or by stress and are usually easily managed.